So I understand everything you have in your forms. First, I want to talk about your elbow. So tell me what's been going on with that.
It's just like accumulated. It was very gradual. Like nothing actually like was something that set it off. It just, I realized one day it was hurting, and it's like right here, and I could feel it mostly when I'm doing pressing movements or pull up, like in a vertical, like in this plane of motion.
Vertical press. Any vertical press, push press.
Not as much. Yeah, push press, split jerk, any of those things.
Front rack?
Not so much in the front rack, actually. But when I'm like warmed up, like it seems to not be, like it doesn't hurt as much, but in the initial stages of getting into the movement, it is a little like,
yep.
Yeah.
Anytime somebody's pointing right to that spot and it gets better with warming up, it's a tendinosis.
I thought so.
So it's degenerating a little bit, but it's early stages, so this is good. We're getting it early. How bad does that pain get? Around 3 out of 10?
Yeah, it's not like anything where I'm like crying or like, wanting to, should stop.
Got you.
Yeah.
I got you.
Yeah.
And then I assume after activity, when you've cooled down, it comes back a little bit?
It's not really prevalent unless I start doing the activity.
It's only to start at the beginning of activity?
Yeah.
The upper back, is that just tight and sore too, or is that a different symptom?
It's more tight and sore. I just don't feel like strong in my upper back because I know that it's so like wound. I don't know, I feel like I could like probably take care of it better, have like better connection to it.
You're here.
Yeah.
You're here. Any other time sitting, reading, texting on your phone, anything that will bring out the symptoms?
So I'm also a graphic designer and artist by profession. So a lot of times I am constantly working on my posture because to receive the barbell, like my shoulders need to be back and like I've learned that I need to like this should be my natural position, but I am like this often when I'm on the computer or like drawing, just how I draw.
And will you feel that symptom?
Once I feel it, I like will try and pull it back.
You will feel it?
Yeah.
How long can you be in that posture before you start to have symptoms there?
Probably like 2 hours.
Any other motion or activity that will bring out the upper back symptoms?
Well, I don't know if this is related, but I guess I'll just put it on the table. So I've had costochondritis before.
Yes.
So my rib like subluxated.
Where?
At first it was right here, but now it's happened in multiple places because I guess it happens once it happens, you're more susceptible to getting it.
Yes.
So I have had it a couple of times, and I feel like it might be related to all that.
Yeah. Well, as an Oli lifter, you need all these intercostals to be stabilizing properly. And if there's adhesion in there or they're just not strong enough, you won't be able to hold up your rib cage anytime that you're receiving, especially like squat cleans or those type of motions. Very helpful to know. Because of the upper back symptoms, I want to see her neck ranges of motion. So does she have adhesion? Does she have internal disc derangement in the neck?
Chin.
We'll see.
Tuck your chin all the way in. Keeping your head up on the block, like just tucking the chin in like this. Beautiful, Courtney. What do you feel with this motion here? 20. You chose -3.
I feel a stretch in the back of my neck.
Here?
Yeah.
Is it going right down the middle or greater on one side?
It might be a little bit greater on the left.
Okay. Just the posterior neck, 0 to 10. How intense is that stretch?
Like a 3.
And I want to confirm you feel it all the way down to here, correct?
Yeah.
Yeah, whole posterior neck, down to the C7 bone. From here, bringing your chin down to your chest. Beautiful, just right there, stop. What do you feel with this motion? 63.
I feel this in like my front and back. Like I feel it in my sternum.
Okay, what are you feeling in the sternum?
Pulling?
Yeah, pulling, kind of.
And then are you feeling it like here?
Yeah, I do feel it there, but I feel it like I'm noticing it more in the front because I'm like, it shouldn't be. I don't know why it feels like it shouldn't be there, but.
How intense in the front, 0 to 10?
It's not that intense, but it's definitely there. Maybe like a 3 or 4.
Okay, how about back here, 0 to 10, bilateral introscap? Sorry, touching your hair.
Like it's 3. I could try and pull it to the other side if you want.
Possibly. For this next one, we're gonna drop your forehead all the way to the floor. You're gonna keep rounding there. I'm gonna push you back just an inch, just like that. Okay, Courtney, what are you feeling with this motion here? 84.
I feel a good stretch like in my spine, like towards
Here.
like yeah.
Right down the middle
yeah.
here? Right down the middle.
And is that the spot that you typically feel it?
Yeah, it's like from my neck to basically down to that spot.
Here. Or here.
Down to where you just
All the way down to mid back.
like yeah.
How intense is that stretch, 0 to 10?
Like a 4 or 5. Kind of the same thing. I feel more. I feel a stretch more on this side though.
Here.
Yeah.
Right lateral neck. How intense is that stretch?
Like 4 or 5.
And are you also feeling something here or no?
A little bit, but it's much more noticeable feeling the stretch on this side.
We're gonna look straight. We're gonna do this again, except this time I'm gonna be measuring. So when you rotate your head, I'm just gonna ask you to keep it on a nice neutral plane so we're not doing this at
Okay.
all. Sound good?
Yep.
Nice and slowly for me. You can go to the right. Stop there. 67.74. Let's look straight again. And to the left. Stop there. 66.73. Beautiful.
Okay.
What do you feel with this?
I feel a stretch like in my torso.
Here,
Yeah.
on both sides.
Yeah.
How intense, 0 to 10?
Go 5.
Okay, anything else? If you relax a little bit, will that still have that same stretch?
Not as much.
Okay, just straightening up with that one. Do you feel anything now different than that?
When I had it up like this, I feel like a little something in here too.
Okay.
Upper belly.
Anything else, Courtney?
No.
Okay, you can relax out of that.
Yeah, see, she's got this space. But I would call this is not. Well, she was also forcing it, and that's why she was getting that symptom.
90 and 20. What do you feel when I do this?
A really big stretch right here.
Right down your forearm.
Yeah.
How intense, 0 to 10?
That was probably like a 7.
Anything else?
Yeah. No.
85 and 30. What do you feel here?
Same thing, but like more kind of. Actually, it's even a little bit more painful on this side. Like more so the wrist. Actually, I feel like.
Okay. How intense was it here?
Probably like 8, like 9.
Is that all that? Mm-hmm. Beautiful. Keeping your shoulders straight, you're just going to bring your right ear to your right shoulder. So 20 degrees. What do you feel?
I feel a little restriction, like a cramping a little bit on this side.
Here.
And more in the back.
Here?
Yeah.
Right posterior neck cramping and restriction. How intense is that? I'm sorry.
No. Probably like a 4.
Anything else?
No. Oh, stretch on this side too.
Stretch.
Yeah.
On the left lateral neck.
Yeah.
How intense is that stretch, 0 to 10?
Probably 4 or 5.
What happens when I do this?
The stretch increases on this side.
Awesome. We're going to do the same thing except left ear to left shoulder. I don't like that side as much. Nope, that's perfect for me. 15 degrees. What do you feel?
I just feel a stretch on this side.
How intense? Is it going into the shoulder or just in the neck?
It's going like as far as here, like kind
To
of.
the trap. How intense? 0 to 10?
Like a 3.
I'm just going to keep. Yes, perfect.
I got it a little bit more.
How high? How
Probably
intense?
4.
4. What happens when I do this?
It
gets worse.
more intense. Yeah.
Beautiful.
So far, you got a lot of positives, which is good because you're not passing all the tests. Let's start with, I'm gonna start going after your elbow first. Normally with the exam, we just feel the tissue and I don't necessarily do much treatment, but today, as I'm scanning, we're just gonna go through treatment.
Okay.
So we're gonna work through a bunch of tissues and let's check your median nerve first. So I'm actually gonna start all in the front here because of course when you're catching in the front rack,
Yeah.
this is the area that's being stretched, this area is being contracted.
Yeah.
So if this is not loose enough, then this is just gonna be overworking no matter how much I treat this.
Okay.
This will never get better if this is all tight.
I usually tense up at first and then
That's all good. It's all
Okay,
good.
so to let you know, we're gonna be straightening your arm for this one. You don't need to do anything. I got it, okay?
Go.
Okay.
It's pretty bad. Good. The carpal tunnel nerve, the median nerve, comes out right underneath this pronator muscle. So I just checked that spot. It was mild to moderate, not as bad as I thought as I did the past.
My dominant hand too, so it's like always working as far as like art.
And now I'm checking underneath flexor digitorum superficialis, the same nerve. Go ahead. See if it's caught and stuck. These aren't too bad, so I'm gonna not do any more passes on those unless I have to.
Yeah.
So of course, all of these anterior forearm muscles come and attach right in here. So I'm starting right at the flexor tendon and I'm just scanning. So this is bad, so I'm gonna do some treatment here.
Okay.
You okay?
Yeah, it's a little painful.
And you got some bruising already, so this is, I would say, moderate to severe, this area. So all this is all adhesion. It's pretty bad. If you didn't have any of this, then we'd be sending you for an MRI and they would likely find some type of tear or whatever. So the fact that you have all this is likely where your symptoms are coming from.
Do you just not do anything and then you don't have things, or like do you just like do the things and like treat it the best you can?
Some of it's just,
Like, what's the healthiest way to go? I mean, it depends.
everything is a progression, right? All fitness is adaptation. So right now we're doing some treatment. This would all be adhesion forms from overload and overuse. So there might be how you're training, recovery, your intervals of when you train, when you put a stimulus on your body, when you recover, what your diet is like, how much sleep you're getting.
It all plays a role. So
it all plays a role. Your symptoms are about in this area, correct? I know you said they go down.
I feel like where you just were was more so like the root.
Here.
No, where you just were before.
Here.
Like on the other
front.
Yeah, right here.
Oh, really?
Yeah, like you were hitting it like.
Oh, got it.
Yeah.
Okay. Okay. Here?
Yeah.
Okay. So flexor tendinosis then. Do you have symptoms over here?
I'm sure there is stuff in there, but where you just were, ooh, yeah.
Okay. Okay. I mean, that makes it easier because it's more directly linked to
like
stretching these
what
tissues.
you were just doing right there is like where I feel it the most.
So we found that just this instrument works really well for the entire body. And I'm very focused on, I'm not necessarily painting your entire forearm and arm, just like brushing it. When I've had Graston, that's usually what the practitioners do. I'm only looking for where I feel this gristle.
Yeah.
So the idea is I'm only damaging the unhealthy tissue. So this is very much more focused from my perspective than what Graston typically is.
93 and 40, what do you feel?
I still feel stretch.
Where is it? The whole forearm still? Yep.
Yeah. And actually more so like I feel like in my fingers too.
In the fingers?
Yeah.
Coming down to the whole entire, all the way to the elbow, or stopping?
More like stopping.
The mid forearm of all the fingers?
Yeah. No. Yeah. Except for my thumb, obviously.
Yes. How intense? 0 to 10.
I would say 6.
6?
Yeah.
Stretch.
So your upper cervical range was 20 degrees, supposed to be 25. That's 80% range. I think I'm gonna start with your suboccipitals and we're gonna do some on your lower neck. Do you feel like anything down here?
Yeah, I am feeling it go a little bit down there
this
too,
way.
yeah.
You definitely have a little bit of disc degeneration in here because it's pulling tight but not really bad. So if you're feeling symptoms down here, it just confirms that where I'm pushing your skull over your spine and your disc is a little bit annoyed by it. So that doesn't mean we won't make your symptoms better. It just means that part of your diagnosis is going to be that you have a little bit of degeneration in your lower neck. Fine. Yeah, I know. Moderate. And this is likely where, so the most common spots that the discs are degenerated is right over here.
Oh.
So when I'm pushing your skull back with
Yeah.
those other muscles and you're feeling it down here, this is likely where it starts to happen in most people. Spinal accessory nerve. This nerve gets stuck, and often when people have upper back symptoms, they can get caught and stuck, and she's having some of these symptoms. So just want to make sure this nerve is free for her.
Okay, keeping your head up against the block, tuck your chin all the way in. What do you feel here with this?
I just feel a good stretch.
That same stretch that you were feeling before back
But
here?
it's not a tight stretch anymore. It just feels like, it feels good.
How
Got
intense? 0 to 10.
2.
Okay.
Or like, it's not like a bad stretch. Like, it's just, I feel more like this.
The front of your neck.
Yeah, the weirdness in the
Okay.
front of my neck.
Makes
Yeah.
sense. Bring your chin to your chest. CF or CTF or both?
CTF.
Drop your forehead to the floor and round at the upper back here. Beautiful. Same thing. Now push your chest edge there. This one. Okay. We are 88. What do you feel with this now?
I feel like I have a better, like, I'm not sure if my chin was touching my chest before.
Okay.
I feel that it's touching my chest, and I feel like things were like more like radiating, and I felt that weirdness in my like sternum, which I don't feel anymore.
You don't feel that now?
No.
Are you feeling anything back here?
I do feel a stretch back there, yeah.
How bad? 0 to 10.
Like a 3, 4.
Okay. It's better.
And still coming from here all the way down here?
Yeah.
Okay, got it. You can come up.
It's always a matter of respecting the puzzle pieces. So like if you're about to put together a puzzle, we need to have all the pieces to be able to see what it looks like. Just because we specialize in adhesion here doesn't mean we can fix everybody 100%. It's our job is to be honest with people's diagnoses and then fix what can be fixed and then just let them know what the rest of the pieces are. So with your elbow, 2 problems. Severe adhesion in the forearm and mild flexor tendinosis. And that's the tendon that you're pointing to on this side, assuming that this is the side that you have more of your symptoms.
Yeah.
And if you have it on the other side, it's a little extensor tendinosis. This can go in the golfer's elbow bucket. So this order is important as well because I love when we get to right adhesion first because that means often when you can get rid of this problem, everything else underneath it will get better too. But let's just talk about adhesion really quickly again. What is it? It's good you have it because this problem is completely fixable and we're the only clinic within 50, 75, 100 miles of certified to find and fix it, so you're in the right place. Your muscle's a piece of steak. It's supposed to be flexible and strong. Adhesion is like glue inside of it, and it makes your muscles tight and weak. And your wrist and finger extension range of motion when we pulled your fingers back, 85 plus 35? Wrist extension was 85 plus 30 degrees. So if I drew a little hand here, this is your hand and this is your fingers. This angle was 85. this angle was 30 degrees. And then when we were done, what did we get her to? 90?
93.
93 plus 40. So that angle went from 85 to 93. This angle with your fingers right here went from 30 to 40. And that's really good. It was one treatment. And you had some less tension, less pulling. And as we remove this adhesion today, you will have less load or stress when you do a front rack or a clean or a press, whatever else it is, the next time you do it. So we chipped away a little bit of this adhesion in a bunch of different tissues, and we can get rid of that. And we went down the list. We checked a bunch of different tissues, 10 different tissues, and most of them were more than moderate on the adhesion level, which again is good because if you have it, it's fixable. When people come in here and they have bad elbow symptoms and they have no adhesion, go get an MRI, you're probably a surgical candidate.
Yeah.
And of course you didn't have major symptoms anyway, but just giving you context for this. Yeah. And then what is tendinosis? Are you familiar with this term?
I am familiar with tendinitis, and I don't know what tendinosis is. Yes. And now I'm like, what's the difference between, what is the difference? What is tendinitis?
Yep.
What is tendinosis? Like,
yes, love it.
Go.
Go. Okay. A normal tendon is like the window in a box of spaghetti. All the fibers going straight up and down. Tendinitis is inflammatory cells inside the tendon from overuse. Typically, tendinitis gets better with rest. When tendinitis continues over a long period of time, eventually the tendon starts degenerating. So instead of having all the tendon fibers going straight up and down, they start getting layered in a haphazard fashion. So they can't handle the stress because they're not all going in the same direction. It's kind of like a rope that's being frayed in different ways, and then it gets stress put on it and it just continues to degenerate. The hallmark symptom of tendinosis is in the early stages of it, it gets better with warming up, and then you don't feel symptoms anymore. And then as you go later in the stages of tendinosis, eventually it doesn't get better with warming up, and then it just becomes more constant and worse. So again, this is very early. So part one of fixing this is removing all the adhesion around it so the muscles can do their job. The other part of it is we did some scraping directly to it to bring blood flow to this, and it's essentially like putting these tendon fibers back in the box of spaghetti. And this problem is fixable as well. Upper back. I'm gonna call this moderate adhesion. Your neck, your nerve roots, at scalenes, your shoulders, 15% restriction. And we likely have some mild, what's called internal disc derangement. So same thing with the adhesion piece, a lot of different spots. Not as much of a home run as your elbow.
It was much more like grindy in there, right?
It's grindy, and you had 2 or 3 data points that this is not your only problem. So if you were to come in here 40 times, a ridiculous amount of times over the next 3 months, I still wouldn't expect you to be 100% better for the rest of your life.
Yeah.
Because you have a little bit of this internal disc derangement. So a normal disc is like a jelly donut. Internal disc derangement is very common in the neck, and it usually shoots down the upper back. There's just a little bit of cracking inside the disc. And it's a low level arthritis from the disc. It's not a big deal. It's just something for you to respect and pay attention to.
Yeah.
Your posture, your strengthening workouts, all that stuff. So yeah, these do get worse over time. Here's how we think about this in this office. Decades on the x-axis of age, osteoarthritis severity on this y-axis. Most of us degenerate on an exponentially increasing curve, meaning we're 10, 20 years old, we have very little aches and pains, little arthritis. 30, 40, 50, start having more aches and pains, more arthritis. 60, 70, 80, we start getting exponentially worse. I don't know about your parents, but my mom and dad are in their 70s and 60s and 70s, and they're showing their age. But what we found is that when people can do the right thing by their symptoms at an earlier age, getting rid of adhesion, no adhesion, making good choices, instead of leaving adhesion in the body and making bad choices, this can get worse a lot slower. And we've had patients go get MRIs after treatment, after years, and it'll stay baseline where it was when they first started the treatment instead of getting progressively worse. One of the most important things for the neck is the ability for your anterior neck and your scalenes. The muscles that pull you back are in the front. So we can strengthen this. And it's pretty simple. You're gonna come on all fours. Your face is gonna be parallel to the ground. You're gonna start, there are 3 positions. So tucked in is 1. So I'm pushing all the way back and in. 2 is I'm keeping my face parallel. I'm bringing my chin down to the floor. 3 is I scoop to my chest. And then from here, I'm pulling my chin back and in so that all these muscles contract.
So you're like dragging your neck back to the start.
Yes. And I'll do this 2 to 3 times per week myself in my routine just to make sure that my mobility and strength is good. Sound good?
Yeah.
Cool.
Thank you.
Thank you so much.
Thank you.
Yeah.